Hi, myself Srija. So today in this session you are going to learn about the accessory structures of skin. So what are the accessory structures? The skin is not only made up of the epidermis and dermis, but it also contains the additional structures called as accessory structures. So these accessory structures, they support the skin function and also they help to maintain the body's overall homeostasis. So in the earlier slide, in the earlier section, we have learned about the hair and hair follicles. So in this session, you are going to learn about the nail structure and nail functions. So what are nails? Nails are hard keratinized plates. They form by tightly packed keratinocytes. So what are keratinocytes? The skin cells that produces the keratin. So they cover the dorsal surfaces of the distal fingers and also the toes. So they play an important role in protection and also the fine movements. So now what is the structure of the nail? So nail unit, it consists of several major parts. So the first part is nail plate. Nail plate is a visible hard part of the nail. It is made up of the compact hard keratin. So this hard keratin, it is stronger and more durable than the skin keratin. So it is naturally transparent, but it appears pink because of the blood vessels beneath it. So whenever the blood circulation is poor, the nails may appear pale or bluish due to lack of the oxygen. So what are the functions of the nail plate? Protection, supports fine motor activities and counter force for gripping objects. So what does it provides the protection? So it shields the sensitive fingertips and also toes from the injury. Whereas in supporting fine motor activities, it helps with the precise tasks like writing, buttoning, clothes and also the typing. So what do you mean by it acts as a counter force? So this provides support to the fingertips. Without nails, the gripping is weak, right? So it provides a support to the fingertips. For in day-to-day life, for example, try peeling an orange or picking a pin without nails. It becomes very difficult, right? So because there is a no counter force. That is the reason nail plate, it acts as a counter force for gripping the objects. So these fingernails, these grow about 3 mm, that is 3 millimeters per month. So toenails grow slower, that is less than 1 mm per month. So nail growth, it increases with the warmth, pregnancy, childhood, and also it decreases with the aging or poor nutrition. So this is about the nail plate. The second part is nail bed. So what is the nail bed? It is a soft tissue which is located underneath the nail plate. So what is the structure? It is formed from the epidermis tightly attached to the dermis. So this nail bed, it has a rich blood supply, which is why the nail plate appears pink. So what are the functions of the nail bed? It supports and nourishes the nail plate. Nothing but it provides, why it is more important? It provides nutrients for strong nail growth so that it nourishes the nail plate. So it also anchors the nail plate to the finger. It keeps the nail firmly attached and it prevents the lifting. So whenever the nail bed becomes infected or inflamed, for example, if someone is suffering from parenchyma, it may cause pain and difficulty using the fingers. So the next part is nail matrix. It is also called as the germinal matrix. So nail matrix, it is the root of the nail. So which is located under the proximal nail fold, hidden under the skin near cuticle area. You can clearly see in the picture here. You can find the nail matrix which is under the proximal nail fold. So this is the proximal nail fold. Underneath you have the nail matrix. So this nail matrix, it is hidden under the skin near cuticle area. So what is the role in nail growth? What is the role of the nail growth? It is the most important part for nail growth. It contains actively dividing keratinocytes. So these cells multiply. After that they get packed and at last they form the nail plate. So if the nail matrix, it gets injured, it can lead to the permanent nail deformity because this nail matrix, once it gets injured, it cannot regenerate properly. It doesn't regenerate because it does not have any proper regeneration factors, abilities. So what are the examples of a permanent changes due to matrix injury? A split nails, uneven growth, and also the loss of nail shine. So this picture, it shows the parts of the nail. So this is a nail plate, which is a visible hard nail. And lateral nail fold, this is the edge of the nail. Lunula, it is a white half moon area which is visible part of the matrix. Nail matrix, it is under the proximal nail fold which is root of the nail. And nail bed, it is tissue under the nail plate. And hyponychium, it is a skin under free edge of the nail. So what is lunula? Lunula, it's a visible part, right? I have shown you in the picture. So lunula, it's a crescent-shaped white region seen at the base of the nail. So it is the visible portion of the nail matrix, but it is only partially exposed. Why is it white? Why lunula appears white? Cells in this region are not yet fully keratinized. Absence of a keratin pigment. So blood beneath cannot be seen, right? So giving it a pale or white appearance. So lunular visibility, it varies from person to person. It is very small or absent lunula may be normal. But a sudden disappearance, they can indicate the systemic diseases like, for example, malnutrition or also the anemia. So next part is about cuticle, eponychium. So what is cuticle? It is a thin band of epidermis which is located at the base of the nail overlapping the nail plate. Here you can see clearly the cuticle in this picture. So what is the function of this cuticle? It seals the junction between the skin and nail plate. So this acts as a protective barrier. It also prevents the entry of pathogens and dirt by reducing the infection risk. It also produces the nail matrix underneath. It ensures healthy nail growth. So why we should not cut or aggressively push the cuticle? Because damaging the cuticle can expose the nail matrix. So what happens if nail matrix is exposed? It may result in nail deformity or the fungal infection, right? So the next part is nail fold. So what are nail folds? Skin folds that are surrounding the nail plate on three sides, nothing but the back plus two sides is called as the nail fold. So you have two types of nail folds. One is proximal nail fold and one is lateral nail fold. So this proximal nail fold, it is located at the back base of the nail, whereas lateral nail fold, it is located at the sides of the nail. So it protects and supports the nail. So nail folds, they prevent the foreign bodies from entering between nail plate and skin. So swelling or pain in nail folds is a sign of infection which is often caused by if you bite the nails and also aggressive manicuring the nails and also the prolonged wet environment. So this picture, it illustrates all the nearby structures: the proximal nail fold, nail matrix, cuticle, lunula region, nail bed, nail plate and hyponychium. So you have to identify each and every part in this diagram. So next, coming to the functions of the nail fold. I already told you what are the functions of the nail fold. It prevents the foreign bodies from entering between the nail plate and skin. So it also guides the nail growth direction. So next, coming to hyponychium. So what is the hyponychium? It is a thickened epidermis which is located under the free edge of the nail. So the part which you trim is called as the hyponychium. So what are the functions of the hyponychium? It acts as a waterproof barrier and microbial barrier. So coming to waterproof barrier, it prevents the entry of water beneath the nail. Whereas in microbial barrier, it stops the dirt, bacteria and fungi from entering under the nail. So this structure is why aggressive cleaning under nails or nail picking can cause pain, bleeding or infection. So the hyponychium gets damaged. So this is about the hyponychium. And next is the free edge. So what is the free edge? It is a distal part of the nail that extends beyond the fingertip. So it is the part that we cut during the trimming. So why again the free edge is white? Because the free edge is not attached to the nail bed. So blood vessels underneath are visible, making it appearing white. So this free edge, it helps in scratching, cutting and also gripping the small objects. So excessively long free edges can drop the microbes. Hence nail hygiene is essential. So let's look into the microscopic structure of the nail. So coming to microscopic structure of the nail, this nail plate has three microscopic layers, each with a different role. So what are the three layers? A dorsal layer, a top layer, intermediate layer and ventral bottom layer. You can clearly see in this picture the dorsal lamella, ventral lamella, and also the intermediate matrix. So what does this dorsal layer do? It is the uppermost layer and it is the hardest layer. It has a resistance properties. It protects the nail. So intermediate layer, it is located at the middle of the layer and it is the thickest in the size. Whereas ventral bottom layer, it is the softest. It adheres to the nail bed and it is also present at the bottom one. So all the layers are composed of keratin, but the keratin becomes harder towards the top to provide the strength and softer near the bottom to stick to the nail bed. So how do you remember these concepts? The matrix makes the nail. So nail plate forms. So the nail bed nourishes it. Nail remains healthy and pink. The lunula is a visible part of the matrix. So the cuticle seals the nail, which prevents the infection. The nail folds, it holds the nail in place. The hyponychium, it acts like a door. It stops the microbes from entering under the nail. The free edge is the extended part that we cut. So these are the concepts you have to remember. So next, going into the next slide, keratin. So what is the composition and strength of the keratin? So nails are made up of keratin, right? These are made up of hard keratin and their toughness is due to the high sulfur content and strong disulfide bonds. So coming to high sulfur content, this makes nails harder than the skin or hair. So it also contains the strong disulfide bonds, right? So what does this disulfide bonds do? This gives the rigidity and also the durability. And also this is made up of the tightly packed keratinocytes. So what is the effect of this tightly packed keratinocytes on nails? It prevents the breakage and also it increases the resistance. So hair has soft keratin, whereas nails have hard keratin. You must remember the difference between hair and nails. Hair, coming to hair, it has a soft keratin. Coming to nails, it has a hard keratin. So that's why nails are stiff and hair is flexible. So next is nail growth. So nails grow, right? They grow continuously throughout our life. They grow regularly, but at a different rates. So what is the average growth rate? For fingernails, it is less than 1 millimeter per week. Whereas toenails, it is also less than or equal to 1 millimeter per month. So therefore, fingernails grow 4x times faster than the toenails. So what is the time for complete replacement? So full regrowth. So what is the time for the full regrowth? Coming to fingernail, 4 to 6 months is the full regrowth time. Coming to toenail, 12 to 18 months is for the complete full regrowth time. So feet have, why toenails grow slower? Because feet have less blood circulation, right? Blood must be circulated from heart to the toes. As these feet have less blood circulation, lower than the temperature, and also less frequent use than hands, these toenails grow slower. So what are the factors which are affecting the nail growth? You have many factors like age, nutrition, hormones, blood flow or circulation, injury or disease, location of the nail, medications and trauma. So coming to the age, what effect it has on nail growth? So this nail growth, it is slower in elderly due to reduced cell turnover. Coming to nutrition, this what does the effect it has? A deficiency of protein, iron, zinc, weak and slow growing nails. So hormones, nails grow faster in pregnancy and thyroid disorders because of the effect of the hormones. So blood flow and circulation. So more blood flow, it gives the faster growth, dominant and grows the faster. The nails grow very faster because of the more blood flow. So injury or disease, this can temporarily stop or permanently deform the nail growth. So what is the location of the nail? Its fingernails grow faster than the toenails, right? So middle finger grows also the fastest. So medication, what is the effect? Chemotherapy and retinoids can slow the growth. Whereas trauma, so these injuries can cause the ridges deformity or temporary halt in the growth. So this is about the factors affecting the nail growth. So fast growth is seen mostly in children, pregnancy women, summer, and in good nutrition, better blood flow. Whereas slow growth of nails can be seen in elderly whenever they has the poor diet, in the winter condition, illness, and also suffering from the poor circulation. So nails can indicate overall health status. So maybe a pale or slow growing nails, this indicates anemia or malnutrition, ridges or splitting due to vitamin and mineral deficiency, and dark discoloration under nail due to the trauma. So next we will discuss about the functions of the nails. So what are the functions of the nails? So nails are not only for beauty, right? They play very important roles in daily life. So the main functions of nails are protection, enhances fine touch, defense mechanism, temperature and moist barrier, cosmetic and communicative role, closed due to systemic diseases. So coming to protection. So the nails, it shield and protect the tips of the fingers, because nails are not only for beauty, they play a very important role in daily life also. So nails shield and protect the tips of the fingers and toes. So these fingertips, they contain very sensitive nerves and blood vessels. So without nails, they could easily get injured. It also helps to prevent the damage during activities like grasping, hitting, or dropping objects. So what is the key point here? Nails act like a hard cover to protect the delicate tissues under them. So what is the other function of the nail? It enhances the fine touch and precise. Nothing but precision. So nails help us to perform delicate and accurate movements. They also apply the counter pressure to fingertip pulp when we touch objects. So it also improves the sensation. So they increases the precision and grip during picking very small objects like pins and beds. So they also increases the writing. They also increases the pressing buttons, threading a nail, or sewing using phone or keyboard. So nails make the fine movements easier and more accurate. So what is the next function? Defense mechanism. So nails can also act as a tool for protection. It is also useful for scratching when there is an irritation. So when we feel irritation or when we feel like itching, we use these nails for the scratching, right? Yeah, it also helps to remove the insects, dirt, splinters, and foreign bodies from the skin. So nails can act as a natural defensive tool. So the main functions are the protection, enhances fine touch, and also the defense mechanism. And the fourth function is a temperature and moisture barrier. So these nails, they mainly provided by the hyponychium, the tissue under the free edge of the nail. It also prevents the microbes and water from entering underneath the nail. So this works like a protective seal under the nail. So it also play a role in cosmetic and communicative role. So nails, they reflect the health, hygiene, and also grooming, right? So if you have a clean and polished nails, so this improve the appearance, and they represent the self-care and also the social communication. So healthy nails is nothing but maintaining a good hygiene and also a confidence. So next function is clues to systemic diseases. So nails act as a diagnostic indicators of the internal illnesses. So what is the nail change over here? Clubbing. So what are the associated condition with the clubbing? Cardiopulmonary disease. It may be a lung or heart disease. So what is the next change? Coelonchia or spoon nails. It is also called as spoon nails. And the associated condition is the iron deficiency, anemia. And the next one is use lines. Stress or systemic illness or severe infection is the associated condition. So next, coming to the oncholysis. It is also called as the nail suppression. So what is the associated condition? It is a thyroid disorder. So blue nails. Blue nails is nothing but the discoloration of the nails. Why blue nails occur? Why do nails appear as blue? Because of the oxygen deficiency. So if you have a less amount of oxygen within your body, so your nails they turn out into a blue. This is all because of the cyanosis, the oxygen deficiency. So cyanosis is the associated condition with the blue nails. So nails can speak about the health inside the body. So these are the functions of the nails. So that's it for today, guys. I hope this session helped you. So in the next session, you are going to learn about the glands of integumentary system. So what are the glands of integumentary system? What are their structures and what are their functions? You are going to learn within the next session. And thank you. Have a good day.